See the perspective of Professor Njemanze. However, this is not the first drug that will be under emergency use authorization, and this is not the first vaccine that is being used for COVID-19. As a regulatory authority, NAFDAC being a regulatory authority, we are part of the International Coalition of Medicine Regulatory Authorities. NAFDAC is the only African country that is being represented there. And every day, information is shared about side effects of or adverse events of serious nature. So it is transparent. For example, anaphylactic reaction. Pfizer, BioNTech, Moderna have reported anaphylactic reactions. Bell palsy, temporary weakness of the muscles of the eye, partial temporary paralysis of the eye muscles. Those have been reported. Should we then have stopped those two vaccines from being used? It is knowing that these are serious, but the benefits outweigh the risks. Do you want hundreds of people to die? Or if there is a very, very minimal chance that somebody will have serious adverse event, you have to. It is logical. People are dying of COVID-19. The vaccine should not be stopped unless it is of a massive, statistically massive occurrence. When I was wanted to take mine, I asked the doctor, do you have drug for anaphylactic reaction? Because I have severe reactions to many things. And the doctor said yes. At the point of injection, I said, did you bring it? I asked the doctor, did you bring it? Because if I were given the vaccine and I faint, then I want them to give me a jab immediately. So will I now say it is my own fainting or whatever is the one that is what caused, it is the vaccine that caused it? No.
Madam, perhaps a challenge. Perhaps the challenge, this information, for instance, that you have put out, perhaps that is the challenge, because I think we've had this conversation before. Many people don't know what they're allergic to. And if there are things that they're allergic to and that the injection could cause a spike or cause a reaction as a result of it, then the challenge is there. I mean, for instance, that you are allergic to a number of things and you had enough information to be able to take that precaution. But we can't say that for all 200 million Nigerians or the 4 million people that are going to, not for all the 4 million people that are going to take the injections.
You are absolutely right, and we are now emphasizing that we should engage the potential vaccinee a little bit longer. Ask about their history. You don't need to take the vaccine if you don't feel good about yourself or you are. For example, how do we know there is no drug-drug interaction? We don't know, and it is at phase 4. Even when not for even vaccine, it is at phase 4 when you are now giving it to millions.
Part of the concerns that a number of people have had is what you have just raised. And let's just hope that indeed, just as you have said, people who are the vaccinators themselves will have enough enough patience to be able to engage the vaccinees, many of which may be ignorant of their own health history, may not even have some of this information. Now, let me reference something that the Commissioner for Health in Lagos said the other time when he talked about 2 categories of reactions: events after vaccination and events of special interest. Could you please clear the air on that? And do we have data from the field of people who have already taken the vaccines, which one of these two categories have we had reports on so far?
Thank you so much. NAFDAC is mandated to have a pharmacovigilance study of many products coming into the market. And we started preparing for this last October or November when we launched Med Safety app. We launched the Med Safety app to collect data. Adverse events following immunizations are like, pain in the arm after the shot, swelling or fever or chills. Those are normal reactions following immunization. However, anaphylactic reaction, like I mentioned, is not a normal reaction following immunization. It is adverse event of serious interest. Bell palsy, temporary paralysis of the face, is adverse events of serious nature or special interest. So we categorize this based on the severity. And at the National Hospital, for the first week, about 550-something healthcare workers were vaccinated. We got a report of about 5 or 6 adverse events following immunization, from a little bit of fever to chills to pain at the site of injection to tummy rumbling, not really going much after that. But we have not recorded adverse event of serious nature or special interest.